Hello everyone, it's Thursday, August 6th. Thanks for watching the weekly update. The numbers haven't changed significantly from last week, but there's some nuances around the numbers that we want to talk about today and some specifics around testing, but we'll get to that in just a few minutes. Let's talk about our numbers at Norton Healthcare specifically. So far, we've tested 59,233 people for COVID-19. That's a big number for a system like Norton Healthcare, but it shows the commitment that we've had to testing both within our organization and out in the community as well. We've received 3,358 of those tests back positive. That's about a 6% positive return rate. Now keep in mind, we've been testing since February, so if you look at the beginning versus where we are right now we're getting about 10% of those that are returned positive as opposed to that average of 6. So we definitely are seeing an increase in the number of tests that are coming back positive. In our inpatient care, we have 54 today. That's compared to last week, we had 69, but again, we're going to talk about what these numbers mean in just a few minutes. So it's down a little bit, but there are some caveats that go with that number being down. We have 21 at Norton Hospital. We have 18 at Norton Audubon Hospital. We have 9 at Norton Women's and Children's Hospital. And we have 6 at Norton Brownsboro Hospital. Unfortunately, we have 0 at Norton Children's Hospital. So far, we've tested 3,295 employees, and we've received back 345 of those tests as positive. And we are beginning to see those numbers inch up a little bit. This time last week, we were only at 293. So again, the virus is spreading in the community, and we are beginning to see that impact some of our employees. So again, we're going to talk about some of that stuff later in this video. Very fortunately, we don't have any employees who are in our inpatient care, so we're very thankful for that. But keep everyone at Norton Healthcare and in our community in your thoughts and prayers as we go forward. We currently have 245 employees who are out on medical furlough. That's up as well from last week. Last week we're at 170, so creeping up 75 from last week. That's a number that we continue to watch and continue to encourage you to work with employee health and make certain that we're coordinating our efforts as we go forward in things like medical furlough. So always during the week, we ask Mike Goff, our Chief Operating Officer, to join us and talk a little bit about what we're seeing from an operational standpoint. So I'm going to ask Mike to join me. So Mike, we're hearing that capacity-wise, we're in good shape. We feel like we've got enough capacity to handle all the numbers that we're seeing and perhaps do just fine into the future with capacity. But what are we seeing from a trend perspective?
Well, in the trend perspective, I'll look at our first graph that we always look at. The top line there, the red line, is the positive patients that we have in-house. And you'll see that we're down a little bit from last week. We were at 69 this time last week. One day last week, we were at a high of 75, but we're down to 54 patients in-house that are confirmed positive. And in terms of patients that are on vents, we've been pretty steady. We've been hanging right around the mid-teens to high teens. Last week we were at 15, and this week we're at 17. So that's the good news, because we were at a high of just over 30 at one point. So we've been about a half of that volume. So from that standpoint, the intensity piece of it, measured by patients that are on vents for COVID, is about half of where it was. So that's kind of the trend that we've seen in the last week.
So one of the nuances that I talked about in the introduction today is a number that we don't talk about a whole lot, but does come into play as we've moved into this part of our journey down this COVID journey, if you will. There is a statistic that we look at that's called patients under investigation. So talk a little bit about what that is and what we're seeing with that.
Yeah, if we look at this graph that we've looked at in the past, but we haven't seen it in a while, we look at suspected patients that we think they come in, they have respiratory illness, and that we are going to screen them out to see if they have it. Last week at this time, we had about 130 patients in-house that were being evaluated for this. And as we said, with the testing capability, that's the lab tests, that we've been able to do those in-house, we could turn those around in about 24 hours. We've seen a big spike in the number of patients now. It's up to 220 on that blue graph if you look at that. And the reason being is because it's taken us longer to get the tests back as we send them out to outside labs. Our inside lab, we have limited capacity now that our supplies have been cut a little bit. So that's where we're doing. So if you see that, really, if you look at the number of patients that we have, on average recently, about 10% you can assume that will be positive. So about 22 of those patients are probably positive. The problem we have is operationally is we have to treat all those patients as if they're positive, meaning they're in isolation, meaning we're using more PPE, and we have to do that. So the faster we can get the test back and confirm whether or not they have it or not is helping us operationally, and also get some, the patients and put them in the right setting.
Right. So it sounds like what you're saying is that there's problems with testing. What's going on with testing that we need to know about?
Well, in terms of testing, the issue is the supplies, that we don't have the supplies, and we used to have the capability to do a significant portion of our testing in-house. Now we have limited supplies to do it ourselves, so we have to send it to outside labs. We're working on solutions to find other labs, not just one or two, and we're working through that right now. But what the problem is, we can get the test done, it's a matter of getting the test back in a timely fashion. We look back at our stats, when we do them in-house, many times we can get them back within 24 hours, 48 at the most. Sending it outside, we're a good time would be 48 hours on average, and sometimes it's 3 or 4 days.
Right. So really there's two components to this that we're talking about with testing. We're talking about we need supplies that we would use to do the testing ourselves in-house that we can do, and we need a quicker turnaround time from the external labs when we can't do it inside, and that's creating the problem for us, and that patients under investigation number goes up because we're waiting to find out if the tests are positive. Is that correct?
Right, that's correct. So the longer we have to wait, the longer they stay in that status, and the longer we have to keep them in isolation. But as we said, we know on average, it varies, but we know about 10% of them are going to be positive, but we have to verify that first.
Right, so we're at 52 today?
Yeah.
Correctly?
54.
54, so based on what we know statistically, we could probably be at, what would that be if?
I think we'd be in the mid-70s where we were. So, from that standpoint, if you view it that way, factor out what the delay is causing from the testing and look at it. We've been pretty steady. We've gone this climb up since early June when we went down as low as 14 in-house, and then we hit 75 one day last week. I'd say that's about where we are right now. So we've kind of, at least for the last 10 days or so, plateaued at that high 60, mid 70 range with confirmed positives in-house.
All right, so we've got more people staying with us until they get their test results back. We always talk about PPE. We always talk about our dashboard for that. We're using more of it, as you said, for people who are there, because it does create the need for isolation and for us to use PPE to go in and out of rooms. Where are we on PPE right now?
Thankfully, we've been working on supplies, as we've said, for PPE, and bringing them in and getting as many as we can hold in our warehouse, and continue to work on that. That piece has eased somewhat in terms of being able to get more PPE. We're in the green for everything, and we measure green by having at least 60 days plus in inventory. And even with the new burn rate at the higher PUIs that we have in-house, we still think we know we're over 60 days in all the categories. So we're in green in PPE.
Okay, so we don't include testing supplies in our dashboard. If we did include those supplies that we need to do the tests in-house, what would our dashboard say about testing supplies?
We would be in the red for sure, because we've got a limited supply right now. We're still saving some for a certain amount of patients that we want to be able to do quickly that we need to. But yeah, we'd be in the red.
Now, you mentioned last week that we had called upon our friends in Washington to help with this. Are we seeing any response there?
Well, as I've said, we're getting a lot of response in terms of they're calling us back, they're getting to us, they're telling us help is on the way, but until we see the trucks pull in the warehouse, it's not here yet. I do think that we'll get some relief from that, but we're still, as we've done throughout this whole time, we work on Plan A, Plan B, and Plan C. So that's Plan A. We're still working on other plans to find other labs that can help us, and to find other supply lines with other labs. We do have another lab that we're working with now that we think we can get on board with some new equipment to do, and they'll have testing that we can do later in September.
Very good. All right, thanks for being with us today, Mike.
Always glad to. Thank you.
One of the things that everybody's done a great job of during this time of COVID-19 has been being flexible and being willing to adjust and change to things that happen. And we get a whole lot of advisories, a whole lot of information on a regular basis from CDC that impacts not only how we treat patients, but how we treat each other as employees. I've asked Dr. Steve Hester to join me today to talk about some of those changes as they pertain to testing and as they pertain to how we handle employees who are being tested or are coming back into the workforce. So I'd like to ask Dr. Hester to join me now. So, Dr. Hester, testing has changed so much since when we started all this in late January or early February, and now it's trickling down to it's changing again for things that we're doing for employees. So we get a whole lot of advice from CDC, we get a whole lot of advice from a lot of different places. We try to do the best we possibly can. What's changing around testing for employees?
Well, I think one of the things, July 20th, they came out with some new recommendations. And basically, we continue to learn more about the virus. I mean,
Right.
It's amazing to think we're just sort of 6 months into this. It sure feels longer. But there's a lot that we've learned in that time period. And so one of the things they're finding is that once you test positive, really after 10 days, regardless of a test result, you're not really infectious to someone else. So it's going to change our testing policy.
Right.
Essentially what we're going to say is that, you come in, and if you're an asymptomatic that tests positive, 10 days from that point, you can come back to work. And so the beauty of that is we sort of have a defined point there rather than these recurrent places where we just continue to test people. I think, the other situation is, you've had symptoms, and from that standpoint, really it's 10 days from sort of the initiation of those symptoms with a positive test. And the fact that you have to be fever-free now for 24 hours where the CDC was saying 72.
Okay, so understand what you're saying is that if you work with employee health, which we always encourage people to do that at the beginning of this process, and you have a test that comes back positive, you're going to be off for 10 days. But when you come back, you're not going to be tested again.
Correct. One test.
One test.
And so it's going to be that first test that happens, and there's not going to be a need to be tested further after that.
Okay. All right, so I hear and get a lot of questions on the coronavirus questions email about, hey, I work on the 5th floor. I understand that Bob was tested and he turned out positive. And I worked with him last Thursday night. I feel fine, but I feel like I need to get tested. How does all that work, and where are we? And what does the CDC say about that?
Again, you're following CDC guidelines and recommendations for healthcare workers would be that we continue to monitor for symptoms. Continue the same things we're doing, masking, social distancing, all the things we need to be doing at work today. But really just follow your symptoms on a daily basis. If you start to get those, be sure to call employee health, but it won't necessarily trigger an immediate testing. Part of that is because you're finding also with some of the new data really is showing that testing someone in those early phases is not really of any value. You want to make sure that you're testing to get the best results out of it as someone who's symptomatic. And so I think when those symptoms are reported, call employee health, and then they'll determine the need for testing.
So let's talk about that for a second. That symptom tracker that we use is so important, and it's going to be even more important going forward. Because we're saying to you, if you feel anything at all, you need to have that conversation with employee health, and you need to get the process. But we're not necessarily saying that always is going to dictate a test. I think one of the things that we need to always remember is that everybody is an individual case, and employee health works with you as an individual on what your symptoms are, what they mean, and what your history is. Is that correct?
Absolutely. There are a lot of things that cause fever.
Right.
So, fever is the most common. So someone shows up at the doctor and has a fever, well, we want to make sure you get worked up for that. So, because if it's not, we don't want to just assume it's COVID. It could be something else. It could be a urinary tract infection, other things that cause fever. So based on that, we make sure you get the right care and make sure we're getting employees taken care of, and employee health is going to work closely with those patients to get the best care.
Right, and if there's any doubt or any question, that's the place to start.
Absolutely.
Right, the number 446-2683. There's people there ready to answer your questions, work with you on an individual basis, and make sure that your situation is handled on an individual basis. Right?
Yeah, and absolutely. If you have a question, or if you and your manager are questioning what the policy should be, then again, reach out to employee health. They'll get the information to you that's necessary and make sure you're taken care of.
So, Steve, talk a little bit about testing in general. The RITC folks are doing a great job, and we're testing so many people. We're testing folks pre-admission. We're testing employees, obviously, and we're testing the community. A question I get all the time is, if tests are running short, why are we testing in the community? Why are we doing so much testing? Can you talk a little bit about
Absolutely.
that?
As Mike said, we are having some challenges with testing and the prioritization there, but I do want you to know that from a priority standpoint, we look at those and say inpatients are that first priority. Obviously, people in the hospital need to be tested first. Then really our pre-admission testing. Somebody needs a procedure, we want to make sure they get tested in a timely fashion. And then our employees. And then from there, it's the community testing. And so when we do that, cutting that community testing wouldn't make those other tests happen any faster. But it's important in the community testing that we continue to do that because it helps with contact tracing. It helps kind of as much as we can, slow down the spread in the community. But then also building the expectation appropriately that when we have those tests done, we're telling people it's going to take a while for those results. If they know they have someone in their home that's positive and they need to isolate, but that result will come back. And we are getting better. We're working with a number of vendors, number of suppliers, trying to continue to improve that. But everybody should know that those community tests aren't impacting our ability to care for patients, specifically on the inpatient side.
Right, right. So last question for you, Steve, but one that I get asked a lot, and I know everyone does, and hopefully we can help with the answer here. We're hearing a whole lot lately about the younger generation being out, going to parties and coming out and spreading this virus all over. What advice can you give us as people who work in healthcare but go home and we're asked questions by our friends, is this okay for kids to get together? And my kids have been isolated with us. Can we get families together? What's your best advice on how we handle those situations?
You know, it's so difficult because each one of those is it's so different.
Right.
But the biggest thing is, you know, it's about being smart. I mean, there come down to some simple things that if you're going to a place where there are 20 people in a single setting, it's not a good idea.
Right.
Especially in a closed space. I mean, a lot of these parties you're talking about are happening inside somebody's basement, and people are commingling. They're not wearing masks. They're not social distancing. Those things, you know, it's amazing how even back when the Spanish flu was here, that's where those came from. Masking and social distancing came from, you know, the early 1900s. Right. Those are things that still show benefit today. And we just need to see that people are smart. They need to make sure they're trying to address it with their kids, have a conversation, especially with schools starting, athletics starting, right. All those things. Just have a conversation that hand washing is so important, masking, and then making sure that they're trying to social distance as much as possible.
Right. It's a very difficult time. I know everybody feels as though we've all been isolated for a long time, and there's a real appetite to get out and do other things. And I guess our message to everyone is try to avoid the situations that you talked about and obviously follow the admonitions that we've all heard about masking and hand hygiene and checking those symptoms.
Yeah, absolutely. And it's going to be challenging. You know, when school starts and people get active again, we just need to make sure you're having, those are important conversations to have with your kids, especially during this time.
Great. Appreciate your time today. Thanks, Steve.
Thank you.
I think it's so important that we recognize and take advantage of all the services that we have at Norton Healthcare. And I know that I thought this time was getting better sometime around the middle of June, and as it turns out, the numbers have come back, and we feel like we're escalating back to a place where we were in February or March, but the difference is we're taking care of a lot of other patients while we're dealing with this COVID-19. It can be overwhelming at times. It can be more than we can handle at times, just from a psychological standpoint. So I think it's so important that we recognize that that's normal. We're going to feel those things, but we have resources available to help you. And it's so important that you utilize these resources way before this gets too far down the road. So I want to remind you, we have an EAP program that is external. You can get employee assistance there. You can get some help, some guidance, some counseling from an external party if that's what fits your needs best. We have the employee emotional support line. You can see the numbers on the slide here. That's an internal line that you can call and have a conversation about how you're feeling, what you can do differently, what you can help yourself with. And it, again, all very confidential. One's external, one's internal. And as always, we have our wonderful chaplains who are there 24 hours a day, 7 days a week to help in any way they can with anything that you need help with. I also think that we have to remember that while we've been fortunate at Norton Healthcare, that we've been able to keep everybody paid through this. We've not had to lay anybody off. We've made the commitment to keep everyone employed during these difficult times, and we're busy now. But in some families, it's created layoffs. It's created things in a spouse or significant other situation that's created a financial hardship. At Norton Healthcare, we think it's important that we look at all the areas that you may have needs, whether they be psychological, whether they be physical, or whether they be financial. We have an employee emergency relief fund that is available. I encourage you, if your family, if you're feeling distress related to a financial situation, please call that line at the People Center. I think you can make an appointment to talk with somebody specifically, have a conversation on the phone, but don't shoulder these burdens alone. Norton Healthcare has resources that we want to help you through these times with, and you certainly are well within the bounds to ask for that help. And it's certainly something that we can facilitate and lighten that burden for you if you need that. So please do not hesitate. Please keep in mind that Employee Emergency Relief Fund is there to help people who are in difficult times get through those difficult times, because we all know these are unusual times. So make certain that you use all of those resources. Also, don't forget, take care of yourself physically. Your In Good Health exams are due by September 15th. Make certain you get that done. It's important that we stay in touch with our physical well-being as well as our psychological and obviously all those other needs. We're an organization that wants to look after as many needs as you have. So I also want to, on a bright spot here before we go out, all 4 of the Norton Healthcare adult hospitals received their stroke designation. So congratulations, great work. We have a lot of folks to take care of while we're doing this other thing called COVID, and you did a great job getting that designation. And how about Lynn Hunley? She was named Volunteer of the Year. So what a great year this area has had, and congratulations to you, and thanks for all you do for Norton Healthcare and for our patients. So I want to close today with a great picture I got from Amy Helwig, who's a chaplain. For us, her granddaughter Tessney is sporting the shades and looking good. And look at that, what it says right below her. What I say every time, stay safe, keep the faith. We'll talk next week.